So you've been told you have knee osteoarthritis. The doctors called you in, they took some x-rays, and maybe they pointed out on the x-rays that narrowing of the joint space. Maybe they showed you that the cartilage is wearing away. And then if you're lucky, they've given you a handout of some exercises they say you can do to help with the pain. Maybe they've given you a referral to physiotherapy, but then they sent you on your way. But they've missed one really important facet of knee osteoarthritis. They told you that it's happened, but they haven't explained the why. And until you know the why, there's nothing you can do to stop the progression of knee osteoarthritis. I know all about this firsthand. I'm Marian Barnick, a kinesiologist for over 30 years and the founder of the Kinetic Stacking Method. I've been through a partial knee replacement, total knee replacement, and a revision total knee replacement when the first one was done completely wrong with the parts rotated 20 degrees. And a doctor that told me, hey, just learn to live with it. I've lived this from the inside, so I know that the diagnosis isn't where things stop. It is not the whole story. So I'm not only going to give you the science of what's going on, I'm going to give you the lived experience of what happens when you've got pain. Someone just gives you the diagnosis and doesn't explain the why, because you need to know the why to have a better life. Because you want to move better, feel better, and perform better. And that's what the Kinetic Stacking Method is all about. And that's what my lifestyle is all about. So stick with me. I'm going to explain some things today about knee osteoarthritis that is totally going to change the way you think about this diagnosis. As I said, my name is Marian Barnick. I'm a kinesiologist, and I've spent over 30 years helping people with knee pain actually understand what's going on in the joint instead of just settling for a diagnosis. So here's what we're going to cover today. We're going to go through what that diagnosis of knee osteoarthritis is all about. Sure, we'll cover that, but then we're going to go in depth. And I'm going to give you a completely different way of thinking about this diagnosis and about knee pain in general. One that finally makes sense and explains why you haven't been able to get long-term success. So let's start with understanding what knee osteoarthritis truly is, because most people have a version of this that is incomplete. Knee osteoarthritis is the breakdown of cartilage. That's the articular cartilage that coats the ends of our bones. It's a smooth, slippery surface, and it allows the bones to move smoothly. So when we look at this knee joint, we want that knee joint to be able to move smoothly. That's what the articular cartilage does. It's covered on both ends of the joint, so both bones here, and it allows for smooth movement of the joint. So think of it as the surface on an ice rink. When it's intact, you can skate smoothly. Everything's clean, everything's smooth, and you move really fast. But then start to think about what that ice looks like when there's bumps and grinds and splinters in there. You get caught on that and you can't move smoothly, and that's exactly what knee osteoarthritis does in your knee joint. Now, the articular cartilage is there for a reason. It's fantastic at absorbing forces. So when you're walking and running and going upstairs, that articular cartilage is what is absorbing the force, and that's exactly what it's meant to do. It's a fantastic design within the knee joint. But here's what makes articular cartilage uniquely vulnerable. It has no blood supply. Unlike skin, unlike muscles that get the blood supply and the nutrients come in and it gets repaired, the articular cartilage doesn't have that. So once the articular cartilage is damaged, it cannot regenerate. Now, I know that there's research going on with things like PRP, but there's nothing definitive right now that indicates proof that we can rebuild articular cartilage. So what this means is that every millimeter of lost articular cartilage is a huge amount of damage in your knee. That's why understanding what's causing the damage to the articular cartilage, to your knee joint, what's causing the pain is vitally important, because every little millimeter that is gone is leading you down that point to knee osteoarthritis, to increased pain, and to less function. You can't afford to be losing ground when you're making guesses at the breakdown of your articular cartilage. We want to stop this, and we want to stop it now. As the articular cartilage wears down, as it shows in the x-ray, that space between your bones narrows. Bones start to rub on bone, pain increases, inflammation increases, stiffness increases, and over time that joint actually becomes deformed. Now, the standard story is that this is just wear and tear. It's something that happens with age, that it's inevitable that everyone's going to end up with knee osteoarthritis. And this is what I am going to challenge. Wear and tear does happen, but it doesn't happen evenly, and it doesn't happen randomly. Think about the tires on your car. If your car is in good alignment, the wear is going to happen all the way across the tires. Now, if one side of the tire is taking more wear than the other, we know the car is not in alignment. And that's what happens to our knees as well. Now, your knee works exactly the same way as the tire. When your body is in proper alignment and moving efficiently, that load is distributed across the whole joint. But when you have movement compensations, and most of us do, the load gets concentrated in specific areas. The cartilage in those areas is what wears out and breaks down. The joint space narrows unevenly, and this is called osteoarthritis. Now, the research confirms all of this information. A systematic review published in Arthritis Care and Research has analyzed 14 separate studies, and this includes 4 high-quality cohort studies, and they found that knee malalignment is an independent cause of knee osteoarthritis. So that means regardless of age, regardless of weight, regardless of anything else, if your knee has malalignment, it is causative of knee osteoarthritis. It's an independent factor. And the worse the alignment, the faster the disease progresses. And here's where this information gets truly relevant. When research looks at patients who have progressed so far that they need a total knee replacement or a TKA, roughly 3/4 of them have demonstrated knee malalignment, either knee varus deformity or knee valgus deformity. That's a huge majority, and that's not a coincidence. That's a pattern. Now, and this is really important, that structural change you see in the x-ray, in many cases, it didn't start that way in the bone. It may have started as a movement problem, compensation patterns that loaded the joint improperly, and that improper loading, those compensations happen step after step, year after year, decade after decade, causing the uneven wear of that articular cartilage and leading to the osteoarthritis. So by the time it shows up on the x-ray, it is actual bone deformity that just started with a simple movement compensation. So osteoarthritis isn't just happening to you. In most cases, it's the result of years and years of unaddressed movement problems, movement dysfunction, movement compensations, quietly grinding away at your knee joint. And this changes everything that we should be doing to approach this diagnosis. Here's what most people aren't talking about when it comes to knee osteoarthritis. And this is what genuinely changes the conversation. Your knee is not a standalone joint. Your ankle and your foot at the bottom, you've got that knee in the middle, and you've got that hip joint at the top. Every single time you take a step, climb the stairs, squat down, play pickleball, play tennis, go for a run, forces travel from the ground, through your foot, up the ankle, to your knee, and to your hip. That is that closed kinetic chain action that we talk about. That's how the forces move through your body. And if something isn't working properly in that chain, if you've got a problem with a toe, with your ankle, if you've got your pelvis rotated slightly, all of this is going to affect how your knee moves. As I've said before, the knee is the victim. It is not the criminal. The crime is happening somewhere else in your body. Now, here's where movement compensations come in. Your brain is incredibly smart. If there's a part of your body that's not working properly, then the brain is going to reroute it to parts that do work properly. Its goal is to keep you functional. So if you have a muscle that isn't working well, a joint that can't be moved properly, your brain will find a way around it. That is the creation of a movement compensation. And it serves us well if you have a trauma, if you've been in a car accident, you've had an injury, you've had surgery, your brain's going to find that workaround to keep you functional. But they don't serve us long term. Once our body has healed, once we get range of motion back, we need to get rid of those automations, those movement compensations that the brain has created. And until we tell the brain, stop compensating, it's not going to do it. It found a workaround. And until you prove to the brain there's a better way to do it, it's going to keep on plugging away with those compensations. And we don't even know about them. They're so natural. We're not even aware that they're happening. But the problem is that these workarounds, these movement compensations, they're inefficient. They load the joints in ways that they were never designed to handle. And the knee sitting right in the middle of your foot and your hip, it's taken that brunt forth. So what does this look like in real life? It could look like a foot turned out slightly, and that rotates the tibia, that bone That makes up part of the knee joint. It could be the rotation of the pelvis, and that rotates the femur. The femur is part of the knee joint. You see what I'm getting at? It could be a heel that lifts off the ground before it's supposed to because you don't have proper knee range of motion. So it's going to put more pressure on that anterior portion of your knee, increasing knee pain, increasing that wear and tear. Every one of these problems, repeated thousands of times a day, day after day, week, years, decades, is going to lead to your knee osteoarthritis. And this is what shows up in the x-rays you see when you go to the doctor's office. Now, as I told you, I've lived this. I went through a partial knee replacement, had a car accident, needed a total knee replacement. Parts were put in wrong. We're cutting through tendons in the back of my knee. I couldn't move properly because the pieces were rotated, so they were causing their own compensations. I had to have a revision knee surgery. Now, I'm telling you this not for sympathy, but to tell you the lived experience when a doctor says, oh, here's your diagnosis, you need a knee replacement, and here's your knee replacement, and everything's fine. You've got new parts. It didn't help me. There were problems beyond the diagnosis. And that's what's going on with knee osteoarthritis. There's problems beyond the diagnosis, but no one's getting there. No one's telling you that you want to decrease the knee osteoarthritis if you can. You want to stop it in its tracks with changes that you can make. If it's in one knee, you don't want it happening in the other knee. That's why just having a diagnosis is not going to bring you comfort, and it's not going to give you long-term results. That's why all those little stretches you do or the little exercises that they're telling you to do, it may give you short-term pain relief, but long-term, you know that pain's coming back because you've lived it. And that's what we want to stop. So if you've been diagnosed with knee osteoarthritis, this is what I want you to take away from this video. Your diagnosis tells you what's happened. It doesn't tell you why. And treating the what with ice, with anti-inflammatories, with generic exercises, maybe even with injections, that's not going to answer the question of why. Without answering the question of why is the reason why so many people aren't getting the long-term results that they want. Sure, you may get some short-term relief with some of the stretches or with your ibuprofen, maybe taking a hot bath. That's not where we want to be in life. We want to be lifelong athletes, and we're expecting more. We don't just want the what. We need the why to get on with our life. The why is almost always in your movement compensations. Those patterns that have been running quietly, subconsciously, on automatic pilot in your body for months, for years, for decades. And that's why your knee is hurting. And those compensations don't go away on their own. They can't be fixed with quad sets and strengthening and clamshell exercises. They need to be identified, unstacked, and corrected in the right order. And that's exactly what the Kinetic Stacking Method is built upon. There are 4 pillars that address the real problem instead of just treating the symptoms. First of all, we need to evaluate enough of those generic exercise programs. We go through a complete movement evaluation to determine your movement compensations and where they are occurring in your body. Only then can we provide corrective exercises to correct your individual problem. There's no guessing. There's no assumption. What you need to train is exactly what a movement evaluation will tell you. Stop wasting time on things that don't work. The second pillar, after we evaluate, is we recalibrate. We break everything down to the foundations. We need to find out where your movement problems are. Is it with mobility? Is it with stability? Do you have motor control problems? That's what we correct prior to moving to the third pillar, which is automate. This is exactly where we tell the brain how we want it to move. We use something specialized called kinetic sequencing, where we retrain the body through specific movement patterns to take away all those dysfunctional patterns and recreate the proper protocols that we want the brain to put on automatic pilot, so we're always moving properly. Once we remove those dysfunctional motor programming with our automation of proper sequencing, do we move to the fourth pillar, which is accelerate. And that's the exciting part of moving into programming your body where you want it to be for the athletic endeavors that you love to participate in. We don't do that first. We don't strengthen first. We don't learn how to hold the paddle, run the court, do our squats because our body's not ready yet. If you've got compensations, let's evaluate to see where they are, recalibrate your body so we can correct them, retrain your brain through automations with sequencing, then we get to accelerate. And that's when your body is going to have long-term relief from pain and long-term ability with better performance. This is why I don't give anyone exercises until I see them move. I don't want to guess. I don't want to make assumptions. I want to know exactly what your body needs, so when I prescribe, you're going to get the results that you're going to love. If you're sitting there thinking that no one's actually explained knee osteoarthritis to you in this way, I'd like you to do a few things. First, hit subscribe and click the bell. I'm going to be going in depth into this information, why you really have knee pain and what you can do about it. So if that interests you, then subscribe. The second thing is I'd love you to put a comment below. Tell me if you have the diagnosis of knee osteoarthritis, and tell me if that stopped you in your tracks where you believe you can't do anything further, because I'd love to chat with you about it. And number 3, if you're tired of guessing and you want to know what's actually driving your knee pain, I'd like you to sign up for the waitlist for our online movement evaluation. We are going to be going through live and online a complete movement evaluation so you can find out exactly how your body's moving, what your compensations are, so you know where you have to focus to bring it down to the foundations so you can build it back up. So marianbarnick.com/waitlist. I'll put that below in the description. Click that, get your name on the waitlist, because that's going to give you first opportunity to get into my class, to do this training with me, do this evaluation, and have a great time learning to understand your body. I hope you've enjoyed this video. I hope you feel empowered with the information I've provided, and I hope you have a great day.